The National Coordinating Agency for Population and Development, NCPD, exists to contribute to the improvement of the well-being of Kenyans and helps preserve national resources by mobilizing political and financial support for population, family planning and reproductive health policies programs. NCPD fosters the development of appropriate policy on urgent population and reproductive health issues through an integrated program of research, policy formulation, advocacy and communication. It seeks to make clear the linkages between population, reproductive health, the environment and development. As Dr. Boniface Koyugi, the Chief Executive Officer, explained.
This agency was established as a state corporation through legal notice number 120 in October 2004. And it is mandated and charged with the responsibility of formulating, coordinating of population policies, strategies and programs so as to be able to match the population growth and the available resources in the country. There are a number of functions which this agency is responsible for. Number one, we are responsible for undertaking analysis of population issues so that to assist in the development of policies and programs. We are also expected to provide leadership and mobilize support for population programs in the country and coordinate all those other players in the population field. We are also expected to undertake the impact assessment of those population programs and policies under implementation and to assist other organizations that are dealing with population issues, and also to identify areas that require attention and advise the government on population issues.
At the time of independence in 1963, Kenya's population was about 9 million people. Today, the population stands at 38 million people, more than 4 times the number of people in 1963, and it is continuing to grow. Even with HIV deaths taking a toll on Kenya's people, the population will keep growing at the current growth rate of 2.8% each year. Kenya's population will increase to more than 42 million people by 2012 and 51 million by 2020. One result of rapid population growth is an overwhelming pressure on land and resources. Agriculture plays an important role in Kenya's economy, yet the high potential agricultural areas account for only 20% of the country's landmass area, with the remaining 80% of the land being arid or semi-arid. In those high potential areas, population pressures have led to increased subdivision of land, leading to lower agricultural productivity. This phenomenon is threatening food security and the country's overall economic growth. The agency therefore has adopted a multi-sectoral approach in discharging its mandate of coordinating policy formulation and programs implementation relating to key concerns of fertility, mortality and migration, which influence the attainment of development goals. NCPD organization structure includes a board, a chief executive officer and 2 deputy directors, one in charge of resource management and the other is responsible for technical services. The 2 departments of finance and human resource management under the resource management division have primary responsibility of resource mobilization and administration. The internal audit department oversees quality in management processes.
My name is Kimeli Chepsirot. I'm a deputy director in charge of resource mobilization and management, which brings together the section dealing with finance, dealing with human resource and general administration. We do get a government grant which mainly supports our operations, particularly paying staff salaries and our operating expenses. But a lot of our field activities are really supported by development partners.
40 years ago, world leaders proclaimed that individuals have a basic right to determine freely and responsibly the number and timing of their children.
A lot of the surveys, for example, we have undertaken have been through the support of key partners, UDFID, USAID, and some of the UN organizations.
USAID is committed to working with the government, development partners, and other stakeholders to provide interventions that will address areas of concern.
And so these are largely the ones that have been able to support a lot of our activities. And when I say USAID, there are many, several subcontracts and that get funds from USAID that work with us more directly. It's important for Kenyans to appreciate that we are interested in a quality population, and a quality population can only come about when we manage our population.
NCPD has two divisions, the one for technical services and the one for finance and resource management. Now in the technical services division, we have a department, 3 departments. We have a department dealing with the program coordination and monitoring, another department dealing with the communication and advocacy, and the third department dealing with research and policy. Our focus is to improve the quality of life of Kenyans, where if you don't have a quality population, you cannot talk about development. And that's how we fit in within the development goals of the government, Vision 2030, and also other goals of MDGs, international goals. From time to time, we are focusing on emerging challenges in the population. In the past, there have been challenges which we focused on, and now things have moved. Issues of youth, now there's a Ministry of Youth which has come up. Issues of gender, now there's a Ministry of Gender. We have also moved to address other populations. There are other vulnerable groups, like the disabled. We have worked with partners to do a survey on disability. And we are moving to other segments of the population. And now we are also trying to move into the elderly. As you know, the elderly comprise 5% of the population, and the issues also should be addressed. As we move to address these issues, we have to work with partners and stakeholders to be able to ensure that the quality of life of the elderly, the disabled, and so on, are also taken care of. We have to ensure that we advocate for the country to focus on these issues that are emerging. We have a very big youthful population, and the youth comes with challenges, both of reproduction and employment and so on. So as we make decisions of the population, we have to be live to the type of population we have. Kenyan population is mainly youthful, so decisions should take issues of the youth into account.
The youth are among the most vulnerable in the society when it comes to the issues of reproductive health. Today, youth are falling prey to risky behavior that predisposes them to unwanted pregnancies, early marriage, and the risk of contracting HIV.
These issues have to be addressed from time to time to ensure that the core population is good enough to be able to focus towards Vision 2030.
Vane Lumumba, who heads Research and Policy Department, explains how research evidence is used to inform policy and programs.
When we do research, which is also our core mandate, we get data which then informs the policy process, so that you have evidence policy. You have a policy which is informed by the evidence which you have collected from the field. So the other mandate which is in this department is to coordinate health and population research, and in that we get data which then now informs whatever policy we come up with. Currently we have the Kenya National Survey for Persons with Disabilities. That is the latest we did in 2007, because we know that in this country data on disability has not been collected before, and so you find even the bill which was passed in Parliament in 2004 on disability, it wasn't informed on figures, it just got information from what was existing, and in that you find even creating or designing targets becomes an issue. But when you have the data, then it informs policy, then you move forward to acting on those issues. The policy brief now, which is informed by the data which we have from the disability survey, is that the women with the disabilities don't access reproductive health services easily.
The World Health Organization estimates that out of every population, 10% are persons with disabilities, and more than 50% are women with disabilities.
My name is Karogo Gatia. I'm the manager in charge of programs coordination, monitoring and evaluation with the National Council for Population and Development. Our main functions are to coordinate population activities implemented by the various organizations. You realize that NCPD itself is not an implementer, but does coordinate what other agencies are doing. And the agencies whom we work with include the NGOs, the community-based organizations, government ministries, and even the activities which are implemented by the private sector. We also do monitor and evaluate the progress being made in course of the implementation. The other function is the coordination of international initiatives related to the population program. This is an initiative that arose from the ICPD Program of Action in 1984, where nations agreed to foster the implementation of the recommendations that will help in addressing population issues. This programs department has what we call the regional initiatives. We have officers who are called the regional population coordinators, and their work is to represent the mandate of the NCPD at the grassroots level.
NCPD has field officers covering 10 regions of the country. These are Northeastern, Coast, Eastern South, Eastern North, Central, South Rift, North Rift, Western, Nyanza North, and Nyanza South. Mr. Aswandili of Eastern North presents the typical work of a regional population coordination office.
My name is Stephen Aswandili, the regional population coordinator, Eastern North, based in Embu. I coordinate about 21 districts, and we have many implementers who implement population programs. So basically my work is to assist agencies and NGOs who implement these programs by way of assisting them to develop proposals for funding, and assist them also in implementing other population issues.
It's a World Population Day. What about it? We stand here to advocate advisable measures. We need a healthy nation. Let's all get together and build our economy. Provide the necessary for our children to avoid unnecessary deaths.
My name is George Kichamu. I'm the Manager, Communication, Advocacy and Public Education at the National Coordinating Agency for Population and Development. The Advocacy Department is one of the departments in the agency with the mandate to provide information, undertake high-level advocacy, and also undertake and coordinate activities that lead to providing information to the public on family planning, population, and reproductive health issues. This is done through development of materials, whereby we develop a number of materials that target specific audiences. For example, some of the materials we have been able to develop in the recent 2 years include a booklet for young people, what we call What is New and Cool for the youth, providing information to the youth on various issues, including reproductive health, HIV/AIDS, and even the role of the young people in the family. We also undertake development of newsletter, a quarterly newsletter, Ken Pop News, that addresses thematic issues depending on what we have agreed upon at that particular time. And this we have found to be very useful in terms of conveying information to particular audiences. The other issue that we are involved in is high-level advocacy at national level and even at lower level. And this advocacy is to target policymakers, political leaders, and opinion leaders to support family planning, population, and reproductive health. This is done through various networks. We have the Parliamentary Network on Population and Development, where we have about 33 MPs that support this process. And we have held a series of meetings with them at regional level, even at national level. and they have been able to support us in terms of ensuring that their resources are allocated to family planning and reproductive health. And this has been important to be able to bring the debate on family planning and reproductive health to national level.
Life and death is a political decision. And I examined myself and realized that it is true that politicians are the ones who provide funding to provide maternal health care. It is the politicians who make also legislation to kind of ensure that whatever they legislate or the guidelines, the laws they formulate are in protecting the lives of the citizen.
More members need to get actively involved in the parliamentary committees and networks that address population, health and development issues.
There is also the Women Parliamentary Group, which we call KEWOPA, Kenya Women Parliamentary Association, which constitutes all the women MPs, and they address issues of population, issues of gender, reproductive rights, and women empowerment and development. This has been an important association in that they have been able to move